Hallux gone, the revolutionary method for pain-free and beautiful feet. What causes a hallux? The formation of a hallux valgus can be due to a variety of causes that can occur individually or in combination. These causes can be both genetic and external and vary from person to person. Below are the main causes of a hallux valgus explained in more detail. Genetic predisposition. Familial inheritance plays a significant role in the development of a hallux valgus. People whose family members have this foot deformity are at a higher risk of being affected by it themselves. Genetic factors can lead to certain foot structures and biomechanical patterns being inherited that can lead to the development of a hallux valgus. Footwear. Wearing unsuitable footwear is a common external cause for the development of a hallux valgus. Tight and pointed shoes with high heels put pressure on the toes and can affect the normal alignment of the big toe. Due to the constant pressure and friction, the deformity can worsen over time. Foot structure and biomechanics. The individual anatomy and biomechanics of the foot can also contribute to the development of a hallux valgus. Overpronation of the foot, in which the arch of the foot flattens inwards, can cause the big toe to deviate outwards. Other foot deformities such as flat feet or hollow feet can also increase the risk of hallux valgus. Weak connective tissue. Weak connective tissue can affect the stability of the foot and lead to the development of a hallux valgus. Connective tissue diseases such as Ehlers-Danlos syndrome or Marfan syndrome can increase the risk of this foot deformity. Overweight and incorrect loading. Overweight and uneven loading of the foot can lead to the development of a hallux valgus. The additional weight puts strain on the ankles and can cause displacement of bone structures, including the big toe. Age and gender. The risk of hallux valgus increases with age as the muscles, ligaments and joints lose elasticity and strength over time. Women are more likely to suffer from hallux valgus than men, partly due to wearing tighter shoes and higher heels. By examining the different causes of a hallux by understanding the cause of hallux valgus, we can take targeted measures to reduce the risk of this foot deformity and enable targeted treatment. Early intervention and the avoidance of risk factors can help prevent the progression of hallux valgus and improve the quality of life of those affected. Why is a hallux valgus more than just a minor foot problem? A hallux valgus is far more than just a cosmetic problem, as it can cause a variety of functional impairments and health complications. Here are some reasons why a hallux valgus should be considered a serious medical concern. Pain and discomfort. One of the most common consequences of a hallux valgus is pain in the area of the big toe. This pain can be caused by friction, pressure points, inflammation and stress on the affected structures. The pain can occur both during movement and at rest and can significantly impair the quality of life of those affected. Limited mobility. The deformity of the big toe in hallux valgus can lead to limited mobility of the joint. This can affect walking, running, climbing stairs and other activities of daily living. The reduced mobility can also lead to changes in gait and increase the risk of falls and injuries. Pressure points and skin problems. Big toe deviation can lead to pressure points, calluses and skin irritation, especially at the base of the big toe and between the toes. These skin problems can be painful and increase the risk of infection, inflammation and arthrosis. An untreated hallux valgus can lead to inflammation in the area of the big toe joint, which can cause swelling, redness and pain. In the long term, chronic inflammation can lead to osteoarthritis in the joint, which can lead to further pain, restricted movement and loss of function. Psychological effects. A hallux valgus can also have psychological effects, as sufferers may experience self-confidence issues, feelings of shame and social isolation due to the appearance of their foot. This can lead to a reduction in emotional well-being and quality of life. Overall, a hallux valgus is therefore much more than just a cosmetic problem. It can cause pain, limit mobility, cause skin problems, promote inflammation and arthrosis, and affect psychological well-being. Therefore, it is important to have a hallux valgus should be taken seriously, and appropriate measures should be taken to relieve symptoms and prevent complications. Myth of hallux valgus. What is true? In this chapter we will address the common myths and misconceptions about hallux. We get to the bottom of bunion and reveal the truth behind the often misconceptions. We show why many of the common assumptions about this foot deformity are misleading or inaccurate, and how these hallux lies can influence the treatment and understanding of the problem. Myth. A hallux valgus is only a cosmetic problem. We explain why a hallux valgus is much more than just a cosmetic concern, and what functional limitations and health complications can be associated with it. Myth. Hallux valgus is a natural consequence of aging. We refute the idea that a hallux valgus inevitably occurs with age, and explains that genetic factors and external influences play a greater role. Myth. High heels do not cause hallux valgus. We show how unsuitable footwear such as high heels is actually a significant risk factor for the development of a hallux valgus, and how this false assumption can lead to further problems. Myth. Insoles and splints can prevent hallux completely. Correct valgus. We explain why sole measures such as insoles and splints are often not sufficient to correct the deformity of a hallux to completely correct valgus, and why a holistic treatment strategy is necessary. Myth. Only surgery can treat a hallux correct valgus permanently. We discuss why the idea that surgery is the only solution for a hallux valgus is a myth, and how non-surgical treatments can offer effective alternatives. By debunking these hallux lies, we want to create a clearer understanding of this foot deformity and help those affected to make informed decisions about their treatment. We show that there are many ways to treat a hallux valgus, and that an individualized, holistic approach is often the best solution. What common misconceptions exist about hallux valgus? There are several common myths and misconceptions about hallux valgus that can interfere with understanding this foot deformity. Here are some of them. Myth. A hallux valgus only affects older people. A common misconception is that hallux valgus is exclusively a condition of older people. In fact, this foot deformity can affect people of all ages, including young adults and even children. Myth. Hallux valgus is exclusively genetic. While a genetic predisposition plays a role in the development of a hallux valgus can play a role, its development is often influenced by a combination of genetic, biomechanical and environmental factors. Myth. High heels are the only cause of hallux valgus. Although wearing high heels and tight shoes increases the risk of hallux valgus, they are not the only cause. Other factors such as foot misalignment, overpronation and weak connective tissue can also contribute to its development. Myth. A hallux valgus can be cured by wearing insoles or splints. Insoles and splints can reduce the symptoms of hallux valgus, but they cannot completely correct or cure the deformity. However, they can be part of a more comprehensive treatment strategy. Myth. The only solution for a hallux valgus is an operation. Surgery is not always the only option for treating a hallux valgus. There are many non-surgical approaches such as physical therapy, special exercises, shoe modifications, and anti-inflammatory medications that can help reduce pain and control the deformity. By dispelling these myths and misconceptions about hallux valgus can promote a better understanding of this foot deformity, allowing those affected to make informed decisions about their treatment and improve their foot health. Why is conventional treatment often inadequate and very painful? The conventional treatment of hallux valgus may be inadequate in some cases because it may not address all aspects of the condition or adequately consider the patient's individual needs and goals. Here are some reasons why conventional treatment can often be inadequate. Treating symptoms instead of fighting the cause. Conventional treatment often focuses on treating the symptoms of a hallux valgus rather than addressing the underlying causes of the deformity. This can lead to the long-term progression of the hallux valgus is not stopped. Non-surgical treatment options may be limited. Conventional non-surgical treatment often includes measures such as insoles, splints, physical therapy, and anti-inflammatory medications. Although these approaches can relieve symptoms, they cannot completely correct the deformity and may provide limited long-term results. Limited effectiveness in advanced cases. In advanced cases of hallux valgus, especially when the deformity is severe and pain is severe, conventional treatment methods may be less effective. In such cases, surgical intervention may be necessary to correct the deformity and relieve discomfort. Lack of holistic approach. The conventional treatment of hallux valgus can sometimes neglect the holistic needs of the patient, including their lifestyle, their individual anatomy and biomechanical factors, and their personal goals and preferences. An individualized treatment strategy that takes all of these aspects into account can often be more effective. Risks and complications of surgery. Although surgical interventions to correct a hallux valgus, they are not without risks and complications. Patients may be wary of the potential risks and effects of surgery and therefore seek non-surgical treatment options. Overall, the conventional treatment of hallux valgus may be inadequate in many cases as it may not adequately address all aspects of the condition and may not always provide the best outcomes for patients. Therefore, it is important to explore alternative approaches and develop an individualized treatment strategy that takes into account the patient's needs and goals. Pain-free without surgery. Is that possible? In this chapter we will look at alternative treatment methods for hallux valgus that aim to relieve pain and improve the functionality of the foot without the need for surgery. We are exploring several non-surgical approaches that may offer promising results. Manual therapy and physiotherapy. We describe the role of manual techniques and physiotherapy exercises to strengthen the foot muscles, improve mobility and correct misalignments. These therapies can help to reduce the symptoms of hallux to relieve valgus and improve foot function. Orthopedic shoes and insoles. We discuss the importance of orthopedic shoes and insoles in the treatment of hallux valgus. By using shoes with a wider toe area and special insoles, pressure points can be reduced. The load on the foot can be evenly distributed and the deformity of the big toe can be corrected. Foot gymnastics and special exercises. We present a series of foot gymnastics and exercise programs aimed at strengthening the muscles in the foot and toe area, correcting the position of the foot and improving the stability of the arch of the foot. These exercises can help to reduce the symptoms of hallux to relieve valgus and promote long-term foot health. Manual therapy and mobilization techniques. We explain various manual therapy techniques and mobilization exercises that can help improve mobility in the big toe joint and relieve pressure points and tension in the foot. These treatment methods can relieve pain and restore the functionality of the foot. Alternative approaches and complementary therapies. Finally, we will look at various alternative approaches and complementary therapies such as acupuncture, chiropractic and reflexology that can be used to relieve pain and discomfort in hallux valgus. These holistic treatment methods can be a valuable addition to conventional approaches and improve the effectiveness of treatment. By offering alternative non-surgical treatments for hallux by exploring the topic of valgus, we want to give hope to sufferers and show them that there are ways to relieve their symptoms and improve their foot health without surgery. It is important to consider individual needs and preferences and develop a holistic treatment strategy that provides the best results for each patient. What non-surgical treatment methods are available still? There are various non-surgical treatment methods for hallux valgus that aim to relieve pain, correct the deformity and improve the function of the foot. Here are some of them. Orthopedic shoes. Wearing orthopedic shoes with a wide toe box and enough room for the big toe can help reduce pressure points and relieve the big toe deformity. Special shoes may also include a supportive insert that stabilizes the arches and strengthens the foot muscles. Insoles. Custom-made insoles can help correct foot alignment by placing the foot in a more neutral position and evenly distributing the load on the forefoot. Insoles can also help relieve pressure points and reduce pain. Physiotherapy and foot exercises. Special exercises and physiotherapy can strengthen the muscles in the foot and toe area, improve mobility and correct the position of the foot. Physiotherapists can develop customized exercise programs that are tailored to the patient's individual needs and goals. Manual therapy. Manual therapy includes various techniques such as massage, mobilization and manipulation that can help improve mobility in the big toe joint, relieve tension and reduce pain. These treatment methods can restore the functionality of the foot and reduce the symptoms of a hallux reduce valgus. Splints and braces. Special splints or braces can be used to bring the big toe into a more neutral position and correct the deformity of the hallux valgus. These devices are usually worn at night and can help improve foot alignment in the long term. Anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, NSAIDs, can be used to reduce inflammation in the metatarsophalangeal joint area and relieve pain. These drugs can be used temporarily to control symptoms, but should not be taken long-term. By combining various non-surgical treatment methods, sufferers can help reduce the symptoms of hallux to relieve valgus, improve foot health, and delay or avoid the need for surgical intervention. It is important to work with a qualified healthcare professional to develop an individualized treatment plan that meets the patient's needs and goals. How can these methods provide long-term pain relief? Long-term pain relief for hallux valgus through non-surgical treatment methods can be achieved through various mechanisms. Correction of foot position. An important aspect of non-surgical treatment is correction of foot position. Using orthopedic shoes, insoles, splints and physical therapy exercises can bring the big toe into a more neutral position, which helps to reduce pressure on the metatarsophalangeal joint and distributes the load on the foot more evenly. Improved foot position can help to reduce inflammation and pain in the long term. Strengthening the foot muscles. Physiotherapy and foot exercises aim to strengthen the muscles in the foot and toe area, which improves the stability of the foot and reduces the load on the metatarsophalangeal joint. Strong foot muscles can help support the arches of the foot, correct foot position and improve shock absorption when walking, which can lead to a reduction in pain and discomfort in the long term. Improve mobility. Manual therapy and mobilization techniques can help improve mobility in the big toe joint and release stuck or restricted tissues. Improved mobility can help reduce tension and stress in the foot and increase flexibility when walking and moving, which can lead to a reduction in pain in the long term. Reduction of inflammation. The use of anti-inflammatory drugs such as non-steroidal anti-inflammatory drugs, NSAIDs, can help reduce inflammation in the metatarsophalangeal joint area and to relieve pain. Although these medications should usually only be used temporarily, they can help control acute symptoms and reduce long-term inflammatory processes. By combining these non-surgical treatment methods and applying them regularly, they can help reduce the symptoms of hallux valgus can be relieved and foot health improved in the long term. However, it is important that sufferers remain patient and consistently follow their healthcare providers' treatment recommendations to achieve the best long-term results. Movement and special exercises. What role does that play? Movement and special exercises play a crucial role in the treatment of hallux valgus because they can help strengthen the muscles in the foot and toe area, improve mobility and correct the position of the foot. Here are some important aspects, such as movement and special exercises in the treatment of hallux valgus can help strengthening the foot muscles. Targeted exercises can strengthen the muscles in the foot and toe area, which improves the stability of the foot and reduces the load on the big toe joint. Exercises such as toe lifts, gripping exercises with the toes and rolling up a towel with the toes can help to activate and strengthen the muscles. Improving foot mobility. Special exercises and movements can help improve mobility in the big toe joint and surrounding structures. This can increase flexibility in walking and moving and help correct restricted movement patterns caused by a big toe deformity. Correction of misalignments. Regular exercise can correct misalignments in the foot and toe area, which can help to normalize the foot position and reduce the load on the metatarsophalangeal joint. Special stretching and mobilization exercises can help to loosen stuck or restricted tissues and promote better alignment of the foot. Arch support. Exercises to strengthen the foot muscles can help support the arches and improve shock absorption while walking. This can help reduce stress on the metatarsophalangeal joint and reduce pain, especially in those with flat arches or overpronation. Promote a healthy gait. Targeted exercises can promote a healthy gait that helps to evenly distribute the load on the foot and avoid excessive pressure on the metatarsophalangeal joint. This can help reduce pain and discomfort when walking and improve foot health in the long term. Overall, exercise and special exercises play an important role in the treatment of hallux valgus because they can help strengthen muscles, improve mobility, and correct foot alignment. By exercising regularly and incorporating targeted exercises, sufferers can help relieve their symptoms and improve their foot health. The path to new foot health. In this chapter we describe a holistic approach to achieving pain-free foot health in hallux valgus. We present a structured path that includes various aspects of treatment and helps those affected to relieve their symptoms and improve their foot health in the long term. The path to pain-free foot health includes the following steps. Comprehensive diagnosis. We emphasize the importance of a comprehensive diagnosis by a qualified healthcare provider to determine the causes and severity of hallux valgus. This includes a thorough clinical examination, imaging techniques such as X-rays, and an assessment of the patient's individual needs and goals. Development of an individual treatment plan. Based on the diagnosis, an individual treatment plan is developed that is tailored to the patient's specific needs and goals. This plan may include a combination of non-surgical treatment methods such as physical therapy exercises, orthopedic shoes, insoles and manual therapy. Consistent implementation of the treatment plan. We emphasize the importance of consistent implementation of the treatment plan, including regular physical therapy exercises, wearing orthopedic shoes and insoles, and adjusting the patient's lifestyle and activities as needed. Continuous progress is monitored and the treatment plan adjusted as needed. Patient education and self-management. We attach great importance to comprehensive patient education in order to increase the understanding of hallux valgus and empower the patient to be an active participant in their own treatment. This includes providing information about the condition, the importance of self-management strategies such as regular exercise and a healthy lifestyle, and training in the correct implementation of exercises and therapy. Long-term follow-up and prevention. Finally, we emphasize the importance of long-term follow-up and prevention to avoid relapse and maintain long-term foot health. This includes regular follow-up examinations, monitoring progress and early intervention when needed, as well as recommendations to prevent further foot problems. By presenting a structured path to pain-free foot health, we want to help those affected to alleviate their symptoms, improve their foot health and increase their quality of life. A holistic approach that includes different aspects of treatment and takes into account the needs of the individual patient can help achieve positive long-term results. Can I relieve my symptoms? Sufferers of hallux valgus sufferers can take several steps to relieve their discomfort and improve their foot health. Here are some important steps sufferers can take. Wearing appropriate shoes. Wearing shoes with a wide toe box and enough room for the big toe can help reduce pressure points and relieve the big toe deformity. Orthopedic shoes or those with a low heel can also be helpful in reducing pressure on the big toe joint. Using insoles. Custom-made insoles can help correct foot alignment by placing the foot in a more neutral position and evenly distributing the load on the forefoot. Insoles can also help relieve pressure points and reduce pain. Physiotherapy and foot gymnastics. Through targeted exercises and physiotherapy measures, the muscles in the foot and toe area can be strengthened, mobility improved and the position of the foot corrected. A physiotherapist can develop an individual exercise program that is tailored to the patient's needs and goals. Manual therapy. Manual therapy, including massage, mobilization and manipulation, can help relieve tension, improve mobility in the big toe joint and reduce pain. An experienced therapist can use various techniques to help relieve the symptoms of a hallux to treat valgus. Anti-inflammatory drugs. For acute pain and inflammation. Temporary use of non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or naproxen may help relieve symptoms. However, These drugs should only be used for a short period of time and under medical supervision. Lifestyle adjustments. People can make lifestyle adjustments to reduce the load on the metatarsophalangeal joint. This includes avoiding high-heeled shoes and narrow-toed shoes and reducing activities that can cause excessive pressure on the foot. By taking these measures and adopting a holistic approach to treating their hallux valgus, they can help relieve their symptoms, improve foot health, and delay or avoid the need for surgical intervention. However, it is important that individuals work with a qualified healthcare provider to develop an individualized treatment plan that meets their specific needs and goals. Individual treatment strategy. An individual treatment strategy for hallux valgus should be based on the individual patient's specific needs, goals, and severity of the condition. Here are some elements that can be included in an individualized treatment strategy. Thorough diagnosis. A comprehensive evaluation of hallux valgus, including clinical examinations and imaging tests such as X-rays, allows the physician to determine the severity of the deformity and identify potential causes and associated conditions. Consideration of symptoms and complaints. The individual treatment strategy should take into account the patient's specific symptoms and complaints, including pain, swelling, limited mobility and functional impairment. Patient's lifestyle and activities. The treatment strategy should take into account the patient's lifestyle and activities to enable realistic and feasible treatment planning. This may include adjustment of footwear, activities and exercise programs. Non-surgical treatment options. Based on the diagnosis and individual needs of the patient, various non-surgical treatment methods such as physiotherapy exercises, orthopedic shoes, insoles, manual therapy and anti-inflammatory medications can be included in the treatment strategy. Surgical options, if necessary. In some cases, surgical intervention may be necessary to correct the deformity of the hallux valgus and relieve symptoms. The decision to undergo surgery should be carefully considered and take into account the patient's individual needs, goals and preferences. Regular monitoring and adjustment. The treatment strategy should be regularly monitored and adjusted as needed to ensure it meets the patient's current needs and goals. This may include adjusting exercise programs, checking the effectiveness of insoles or splints, and assessing pain and functional levels. An individual treatment strategy for hallux valgus should therefore be treated with a holistic approach that takes into account the patient's specific needs and goals and includes various non-surgical and surgical treatment options. Working with a qualified healthcare provider who has experience in treating hallux valgus is crucial for the development and implementation of an effective individual treatment strategy. Finally, the right shoe. The right choice of shoes plays a crucial role in the treatment and prevention of hallux valgus. Here are some key points that underline the importance of choosing the right shoes for people with this foot deformity. Relieve pressure on the metatarsophalangeal joint. Well-fitting shoes with a wide toe box can help reduce pressure on the metatarsophalangeal joint and relieve pain. Having enough room in the toe box prevents the big toe from becoming constricted and pressing against neighboring toes, which could worsen the deformity. Stability and support. Shoes with a stable sole and adequate arch support can help relieve strain on the foot muscles and reduce stress on the metatarsophalangeal joint. This is especially important for people with flat arches or overpronation, as unstable shoes can worsen symptoms. Avoid high heels. Wearing high-heeled shoes can increase the load on the metatarsophalangeal joint and cause hallux deformity. Valgus can worsen. Flat shoes or those with a moderate heel height are therefore often a better choice for people with this foot deformity. Adaptation to individual needs. The right shoe choice should also take into account the individual needs and activities of the wearer. For example, people who regularly engage in sporting activities may need special sports shoes with additional cushioning and support to reduce the load on the metatarsophalangeal joint. Regular inspection and adjustment. The fit and condition of shoes should be checked regularly to ensure they are still appropriate and meet the wearer's needs. Worn or uncomfortable shoes should be replaced to prevent further damage. Overall, the right choice of shoes plays a crucial role in the treatment and prevention of hallux valgus, as well-fitting shoes can help reduce pain, relieve the deformity, and improve long-term foot health. It is important that sufferers pay attention to selecting appropriate shoes and seek professional advice when necessary to ensure their shoes meet their individual needs. Prevention and care made easy. In this chapter we focus on long-term measures to prevent hallux valgus and foot health care. We look at various aspects that can help reduce the risk of hallux to reduce valgus and maintain long-term foot health. Healthy lifestyle. We stress the importance of a healthy lifestyle that includes regular exercise, a balanced diet and sufficient rest and relaxation. A healthy lifestyle contributes to overall health and can reduce the risk of foot problems such as hallux reduce valgus. Choosing the right shoes. We explain again the importance of choosing the right shoes and give tips for choosing shoes that support the foot, offer enough space and reduce the load on the big toe joint. By paying attention to choosing the right shoes, those affected can help to avoid foot problems. Regular foot care. We discuss the importance of regular foot care, including washing, drying, trimming nails, and maintaining good hygiene. Proper foot care can help prevent infections and skin problems and maintain foot health. Weight management. We point out that overweight and obesity increase the risk of hallux valgus because they place additional stress on the feet and joints. Maintaining a healthy weight or losing weight can therefore help reduce the risk of foot problems. Regular exercise and foot exercises. We recommend regular exercise and foot exercises to strengthen the muscles in the foot and toe area, improve mobility and promote foot health. Regular exercise keeps the feet flexible and strong, which can help reduce the risk of foot problems. Early detection and early intervention. We emphasize the importance of early detection of foot problems such as hallux valgus and early intervention to avoid the development of serious complications. Regular foot examinations and attention to changes or complaints are important in order to take appropriate measures in a timely manner. By incorporating long-term preventive and care measures into their daily routine, those affected can help maintain their foot health and reduce the risk of foot problems such as hallux valgus. It is important that these measures are implemented continuously and consistently in order to achieve long-term positive results. How can you prevent hallux from recurring? To prevent recurrence of hallux to prevent valgus, those affected can take various measures. Wearing appropriate shoes. Continuously wearing shoes with a wide toe area and sufficient space for the big toe can help reduce the load on the metatarsophalangeal joint and prevent recurrence of hallux to prevent valgus. Shoes with a stable sole and sufficient arch support are also important. Regular foot care. Regular foot care, including washing, drying, trimming nails and maintaining good hygiene, can help prevent infections and skin problems and maintain foot health. Weight management. Maintaining a healthy body weight can help reduce stress on the feet and joints and reduce the risk of foot problems such as hallux to reduce valgus. Regular exercise and foot exercises. Regular exercise and targeted foot exercises can strengthen the muscles in the foot and toe area, improve mobility and promote foot health. Strong and flexible feet are less prone to foot problems such as hallux valgus. Early detection and early intervention. Regular monitoring of foot health and attention to changes or complaints can help prevent recurrence of hallux. To detect valgus early and take appropriate measures to prevent further complications. Consistent use of non-surgical treatment methods. If a person already has hallux once valgus has been diagnosed and non-surgical treatments have been successfully used to relieve symptoms, it is important to maintain these measures long-term to prevent recurrence. By consistently implementing these preventive measures and actively maintaining their foot health, those affected can help prevent a recurrence of hallux valgus and improve their quality of life. It is important that these measures are implemented continuously and consistently in order to achieve long-term positive results. Foot care and regular examinations. Foot care and regular examinations play an important role in preventing foot problems such as hallux valgus and maintaining foot health. Here are some reasons why foot care and regular examinations are important. Preventing foot problems. Regular foot care, including washing, drying, trimming nails and maintaining good hygiene, can help prevent infections, skin problems and other foot problems. Regular inspections can help identify potential problems early and treat them before they get worse. Detecting changes. Regular examinations of the feet make it possible to detect changes such as swelling, redness, deformation or pain at an early stage. These changes could indicate the onset of foot problems, which should be treated in time if necessary to avoid further complications. Early detection of hallux valgus. A regular examination of the feet can help prevent hallux. Detecting valgus early before the deformity worsens and causes symptoms such as pain and limited mobility. Early interventions can help slow the progression of the disease and reduce the need for surgical treatment. Advice and guidance. During regular examinations, healthcare providers can provide advice and guidance on foot care, proper shoe selection, foot exercises and other preventative measures. This information helps patients improve their foot health and reduce the risk of foot problems. Control of risk factors. For people at increased risk of foot problems such as diabetes or poor circulation, regular examinations are particularly important in order to detect and treat potential complications at an early stage. Early intervention can help prevent serious consequences and maintain foot health. Overall, foot care and regular examinations play a crucial role in preventing foot problems and maintaining foot health. By taking regular care of their feet and having them examined by qualified healthcare providers, sufferers can help identify and treat potential problems early to improve their quality of life and avoid complications. Which Schussler salts can help? Schussler salts are often used in alternative medicine to support health, but their effectiveness is not sufficiently scientifically proven. Nevertheless, there are some Schussler salts that are often used in traditional European medicine for foot problems such as hallux valgus. It is important to emphasize that the use of Schussler salts in connection with foot problems such as hallux valgus should not be seen as a sole treatment method. but as a complement to a holistic treatment approach. Here are some Schussler salts that could help. Calcium fluoritum. Schussler salt number 1. This salt is often used for weak connective tissue and hardening, which can be helpful in hallux valgus can be important because it is a deformity of the foot that can be associated with a weakness of the connective tissue. Cilicia. Schussler salt No. 11. Cilicia is often used in the treatment of musculoskeletal problems and can help promote tissue regeneration and strengthen connective tissue. Calcium phosphoricum. Schussler salt No. 2. This salt is sometimes used for bone and joint problems and can help promote bone health. Ferrum phosphoricum. Schussler salt No. 3. Ferrum phosphoricum is often used for inflammation and pain and can therefore be used to relieve pain associated with hallux valgus can be helpful. It is important to consult a qualified healthcare provider or naturopathic expert before using Schussler salts for individualized advice and dosage recommendations. In addition, Schussler salts should not be considered a substitute for conventional medical treatment, especially when it comes to serious illnesses or complaints such as hallux valgus goes. What lifestyle changes and hallux? Long-term lifestyle changes can make a significant contribution to the prevention of foot problems such as hallux valgus and improve foot health in the long term. Here are some important lifestyle changes that can help in the long term. Weight management. Maintaining a healthy body weight is crucial to reduce the strain on the feet and joints. Being overweight or obese can increase the risk of foot problems such as hallux valgus, so it is important to maintain a balanced diet and be physically active on a regular basis. Choosing the right shoes. Choosing the right shoes plays an important role in maintaining foot health. Shoes with a wide toe area, enough room for the big toe and a stable sole can help reduce the load on the big toe joint and prevent foot problems. Regular exercise. Regular physical activity strengthens muscles, improves circulation and promotes flexibility in joints, including foot muscles. Appropriate activities such as walking, swimming, cycling or yoga can help maintain foot health and reduce the risk of foot problems. Foot exercises and movements. Targeted foot exercises and movements can help strengthen the muscles in the foot and toe area, improve mobility and promote foot health. Regular stretching. Strengthening exercises and rolling up a towel with the toes can help improve the flexibility and stability of the feet. Stress management. Stress can negatively impact foot health by causing muscle tension, increased pressure on the feet and poor circulation. Stress management strategies such as relaxation techniques, meditation or taking regular breaks can help support foot health in the long term. Smoking cessation. Smoking can impair blood circulation in the extremities and increase the risk of foot problems such as hallux valgus. Quitting smoking can therefore help improve foot health and reduce the risk of foot problems. By implementing long-term lifestyle changes such as weight management, proper shoe selection, regular exercise, foot exercises, stress management and smoking cessation, sufferers can improve their foot health in the long term and reduce the risk of foot problems such as hallux valgus. It is important to implement these changes continuously and consistently to achieve long-term positive results. Vitamins or minerals for hallux valgus. Vitamins and minerals play an important role in the health of bones, joints and connective tissue and can therefore also be used in the treatment and prevention of foot problems such as hallux valgus. Here are some vitamins and minerals that may help. Vitamin D. Vitamin D plays an important role in bone health because it aids in the absorption of calcium and phosphorus, which are important for bone strength and structure. Adequate vitamin D levels can therefore help promote bone health and reduce the risk of foot problems. Calcium. Calcium is an essential mineral that is vital for bone health. Adequate calcium intake can help maintain bone strength and prevent osteoporosis and other bone problems that increase the risk of foot deformities such as hallux valgus could increase. Magnesium. Magnesium is involved in the regulation of muscle contractions and the formation of bone tissue and can therefore help promote muscle and bone health. Adequate magnesium levels can also help reduce muscle cramps and tension associated with foot problems such as hallux valgus could be associated. Vitamin K. Vitamin K plays a role in regulating bone metabolism and mineralization and therefore may help support bone health. Adequate vitamin K levels may help maintain bone strength and reduce the risk of foot problems. Vitamin C. Vitamin C is an antioxidant that is involved in the formation of collagen, an important component of connective tissue. Adequate intake of vitamin C can help maintain the elasticity and strength of connective tissue and promote the health of ligaments, tendons and joints. It is important to emphasize that taking vitamins and minerals alone is not enough to treat foot problems such as hallux to treat or prevent valgus. A balanced diet rich in nutrients and a healthy lifestyle with regular exercise, proper foot care and appropriate footwear are also important factors in foot health. Individuals who have concerns about their nutritional intake should consult a qualified healthcare provider for individualized advice. Which easy exercises can help? Light exercise can help strengthen the muscles in the foot and toe area, improve mobility, and promote overall foot health. Here are some light exercises that can help. Spreading and bringing your toes together. Sit on a chair and place your feet flat on the floor. Then slowly spread your toes apart and hold the position for a few seconds. Then bring your toes together again and repeat the movement several times. Toe curl. Place a towel on the floor and place your feet on it. Then curl your toes to grab the towel and hold the position for a few seconds. Then release the towel and repeat the exercise several times. Foot rolling with a massage ball. Sit in a chair and place a massage ball or tennis ball under one foot. Gently roll the ball back and forth under your foot, paying special attention to any tight or painful areas. Then switch to the other foot. Heel rises and lowers. Stand with your feet hip width apart and slowly lift your heels off the floor by standing on your tiptoes. Hold the position briefly and then lower your heels back to the floor. Repeat the movement several times. Foot circles. Sit on a chair and lift one foot off the floor. Then slowly draw circles with your foot in both directions, moving your toes outward and then inward. Then switch to the other foot. Foot exercises with a TheraBand. Sit on a chair and place a TheraBand around the ball of one foot. Hold the other end of the band with your hands and slowly pull it backwards while pressing your foot against the resistance of the band. Hold the position briefly and then return to the starting position. Repeat the exercise several times and then switch to the other foot. It is important to perform these exercises slowly and in a controlled manner, and if necessary, place a support such as an exercise mat or towel under the foot for comfort and stability. Start with a low number of repetitions and gradually increase the intensity as you feel more comfortable. If you already suffer from foot problems such as hallux valgus or have any concerns, you should consult a qualified healthcare provider before starting any exercise program. Which footwear is best? The best footwear for people with hallux valgus should have certain features that help reduce pressure on the metatarsophalangeal joint, relieve the deformity and reduce pain. Here are some features to look for when choosing shoes. Wide toe box. Shoes with a wide toe box provide enough space for the big toe and prevent it from being pressed against the neighboring toes. This helps to reduce pressure on the metatarsophalangeal joint and slow the development of the hallux valgus deformity. Soft and flexible materials. Shoes made of soft and flexible materials such as leather or mesh adapt better to the shape of the foot and prevent friction and pressure points that can cause pain. Avoid shoes made of hard or stiff materials that can limit the foot's freedom of movement. Padded insole. A well-padded insole provides additional comfort and cushioning when walking and helps reduce pressure on the metatarsophalangeal joint. Some shoes have removable insoles that can be replaced with custom orthopedic inserts. Stable sole with sufficient support. Shoes with a stable and non-slip sole provide additional support for the foot and help reduce the load on the metatarsophalangeal joint. A sole with a slight bevel in the area of the metatarsophalangeal joint can also help relieve the deformity and reduce pain. Adjustable fasteners. Shoes with adjustable fasteners such as Velcro or laces allow for individual adjustment to the shape of the foot and provide a better fit and stability. This is especially important for people with hallux valgus, as a good fit is crucial to avoid pressure points and friction. Heel height. Flat shoes or those with a low heel height are often the best choice for people with hallux valgus as they reduce stress on the metatarsophalangeal joint and improve stability. Avoid high heels as they can worsen the deformity and cause pain. When choosing shoes for hallux valgus, it is important that you try different models and pay attention to comfort, fit and support. It can also be helpful to seek advice from a specialist retailer or an orthopedic shoemaker to find shoes that best suit your individual needs. Which foot baths help with pain? Foot baths can be a relaxing and soothing way to support foot health and relieve problems such as hallux valgus. Here are some types of foot baths that can be good for your feet. Warm water foot bath. A simple warm foot bath can help relax muscles, improve circulation and relieve pain. Fill a bowl or foot bath with warm water, not too hot to avoid burns, and optionally add essential oils such as lavender or mint for additional relaxing effects. Salt foot bath. Salt foot baths can have an anti-inflammatory and pain-relieving effect. It is best to use natural sea salt or Epsom salt. Magnesium sulfate. Dissolve a handful of salt in warm water and soak your feet for about 15-20 minutes. This can help reduce swelling and promote relaxation. Herbal foot bath. Herbs like chamomile, rosemary or arnica can have soothing and anti-inflammatory properties. You can add fresh or dried herbs to your foot bath or use pre-made herbal teas. Let the herbs steep for a few minutes before soaking your feet. Apple cider vinegar foot bath. Apple cider vinegar has anti-inflammatory and antimicrobial properties and can therefore be helpful in treating foot problems such as fungal infections or skin irritations. Mix a cup of apple cider vinegar with warm water and soak your feet for about 15-20 minutes. Baking soda foot soak. Baking soda can help remove excess dead skin and soften the skin. Add half a cup of baking soda to warm water and soak your feet for about 15-20 minutes. This can be especially helpful in reducing calluses and improving foot health. Note that foot baths alone may not be enough to treat serious foot problems such as hallux valgus. Treatment should not be used to treat bunion deformity, but as a complementary measure to a holistic treatment approach. If you have any concerns about your foot health or are experiencing pain, it is advisable to seek advice from a qualified healthcare provider. Which Bach flowers can help? Bach flowers are a form of alternative medicine used to provide emotional support and promote well-being. They can help manage stress, anxiety and emotional challenges associated with foot problems such as hallux valgus. Here are some Bach flowers that can be used to treat hallux valgus can be considered. Rock water. This Bach flower is recommended for people who tend to self-denial, strictness and perfectionism. People with hallux valgus may feel self-critical or frustrated because of their foot deformity. Rock water can help develop a more flexible attitude toward themselves and their circumstances. Mimulus. Juggler's flower. This Bach flower is recommended for people who suffer from fears or phobias, especially of specific things or situations. People with hallux valgus may have fears of pain, limitations or the judgment of others. Mimulus can help overcome these fears and develop more courage and confidence. Agrimony. This Bach flower is recommended for people who have difficulty showing their inner conflicts and worries and instead maintain a cheerful exterior. People with hallux valgus may have repressed emotional burdens that could be impacting their foot health. Agrimony can help release inner tensions and enable authentic self-expression. Walnut. This Bach flower is recommended for people who are sensitive to changes or external influences and have difficulty adapting. People with hallux valgus may have difficulty adjusting to their new foot situation or accepting changes in their life. Walnut can help support them in adapting and walking through changes with strength. Oak. This Bach flower is recommended for people who are strong and resilient, but tend to overexert themselves and exceed their limits. People with hallux valgus may tend to continue to overexert themselves or work too much despite their foot problems. Oak can help find a healthy balance between exertion and rest. It is important to note that Bach flowers have a gentle and supportive effect and should not be used as a substitute for appropriate medical treatment. People with hallux valgus should, if necessary, consult a qualified Bach flower therapist or consult your healthcare provider for individualized advice and dosage recommendations. Which tea recipes relieve pain? There are various tea recipes that help relieve pain associated with foot problems such as hallux valgus. Here are some herbs and teas that have anti-inflammatory, analgesic and soothing properties and can therefore be helpful in treating foot pain. Ginger tea. Ginger has anti-inflammatory properties and can help reduce pain and inflammation. To make ginger tea, cut fresh ginger into thin slices and add them to a cup of boiling water. Let the tea steep for about 10-15 minutes before straining and drinking. You can sweeten the tea with honey or lemon juice if you like. Turmeric tea. Turmeric is known for its anti-inflammatory and pain-relieving properties. To make turmeric tea, add a pinch of turmeric powder and a small dash of black pepper to a cup of hot water. Let the tea steep for about 10 minutes before straining and drinking. You can sweeten the tea with honey or milk if you like. Chamomile tea. Chamomile has anti-inflammatory and soothing properties and can help relieve foot pain. Prepare chamomile tea by steeping dried chamomile flowers in hot water. Allow the tea to steep for about 10 minutes before straining and drinking. Chamomile tea can also be used topically by soaking your feet in warm chamomile tea. Peppermint tea. Peppermint has cooling and analgesic properties and can help relieve foot pain. Prepare peppermint tea by steeping fresh or dried peppermint leaves in hot water. Allow the tea to steep for about 5-10 minutes before straining and drinking. Peppermint tea can also be used externally by soaking your feet in warm peppermint tea. Willow bark tea. The bark of the willow tree contains salicin, which is converted in the body into salicylic acid, a natural anti-inflammatory agent that works similarly to aspirin. To make willow bark tea, place a handful of willow bark pieces in a pot of water and boil for about 10-15 minutes. Allow the tea to cool before straining and drinking. These teas can help relieve pain, reduce inflammation, and promote overall relaxation. However, it is important to note that teas alone may not be enough to treat serious foot problems such as hallux valgus, but should be used as a complementary measure to a holistic treatment approach. If you are experiencing persistent or severe foot pain, you should contact a qualified healthcare provider for appropriate medical treatment. Interesting stories from people for people. In the 6th chapter, Case Studies and Success Stories, concrete examples are presented of people who have successfully overcome their hallux valgus problems with the help of the therapy methods and advice presented. These case studies serve to show readers how the treatment methods presented were applied in practice and what results were achieved. Various experiences and successes of people with hallux valgus is highlighted to illustrate the variety of possible treatment options and individual successes. The chapter could have the following structure: Introduction to the case studies. A brief introduction that explains the purpose of the case studies and prepares readers for the stories that follow. Case Study 1. Maria's Journey to Pain-Free Foot Health. Describes the story of Maria, a patient with long-standing hallux valgus problems. It explains what symptoms she had, what conventional treatments she tried, and how she finally found an alternative therapy method that helped her relieve her pain and improve her foot health. Case Study 2. Marcus' success story with exercises and shoe selection. Description of the story of Marcus, an active athlete who was affected by his hallux valgus problems. It shows how he was able to successfully overcome his problems through targeted exercises, the right choice of shoes and adjustments to his lifestyle, and can walk again without pain. Case Study 3. Laura's experiences with holistic therapy. Describe the story of Laura, a holistically oriented person who combined different therapy methods to treat her hallux valgus symptoms. It explains how she was able to achieve a significant improvement in her symptoms through a combination of foot exercises, shoe selection, dietary changes, and relaxation techniques. Summary and outlook. A summary of the case studies presented and an outlook on the importance of holistic treatment approaches and individual therapy strategies in dealing with hallux valgus. By presenting real case studies and success stories, readers will gain practical insights and inspiration on how to tackle their own foot problems. It is made clear that there are different ways to deal with hallux valgus and that each person can find the most suitable treatment methods for themselves. People's experiences with non-surgical treatment methods. People who seek non-surgical treatments to relieve hallux valgus often report a variety of positive experiences. Here are some frequently mentioned experiences. Pain relief. Many people report that non-surgical treatments such as foot exercises, special insoles, shoe changes, and alternative therapies have helped reduce or even eliminate their pain. By reducing pressure on the metatarsalophalangeal joint and strengthening the muscles, these methods can help reduce pain and improve foot health. Improved mobility. Through targeted exercises and therapies, people with hallux valgus can improve their mobility and flexibility. This can help them move better, stay active, and perform everyday activities without pain. Slowing the deformity. Some people report that non-surgical treatments have helped slow the progression of the hallux valgus deformity. Using appropriate footwear, orthotics and foot exercises can help reduce the stress on the metatarsophalangeal joint and prevent further worsening of the deformity. Better quality of life. By relieving their pain and improving their mobility, people with hallux valgus often improves their quality of life. They can be more active again, enjoy their favorite activities and feel better overall. Avoiding risks and complications. Non-surgical treatments can help avoid risks and complications associated with surgical procedures. People who choose not to undergo surgery or are not candidates for surgery can still achieve effective pain relief and improvement in their foot health through non-surgical treatments. It is important to emphasize that experiences with non-surgical treatment methods can vary from person to person and that not every method is equally effective for everyone. However, a holistic approach that combines different treatment methods and is tailored to each individual's needs can often produce the best results. People with hallux valgus should consult with a qualified healthcare provider to determine the most appropriate treatment options for them. What individual paths led to pain relief? The ways to pain relief from hallux valgus are extremely diverse and individual. Every person is unique, and accordingly, the treatment approaches and measures that led to pain relief can vary greatly. Here are some individual ways that people with hallux valgus can be used to achieve pain relief. Combining different therapies. Some people find pain relief by combining different non-surgical treatment methods such as foot exercises, orthotics, special shoes, physical therapy, massage and alternative therapies such as acupuncture or chiropractic. By combining different approaches, they can achieve synergistic effects and effectively relieve their symptoms. Individually tailored shoe care. Choosing shoes with a wide toe area, sufficient cushioning and support, and a stable sole can help reduce pressure on the big toe joint and relieve pain. Some people find pain relief by fitting orthopedic shoe inserts or using special shoes for hallux valgus. Targeted foot exercises and physical therapy. Regularly performing foot exercises that strengthen muscles, improve mobility, and correct the alignment of the big toe joint can help reduce pain and improve foot health. A physical therapist can create customized exercise programs and help relieve pain. Holistic lifestyle approach. Some people find pain relief by adjusting their lifestyle, including a healthy diet, adequate exercise, stress management techniques and relaxation practices such as yoga or meditation. A holistic approach can help improve overall health and reduce pain associated with hallux to relieve valgus. Alternative therapies. Some people find pain relief through alternative therapies such as acupuncture, chiropractic, osteopathic manipulation, or kinesiology. These therapies can help balance the flow of energy in the body, release tension, and activate the body's own healing powers. It is important to emphasize that every person responds to treatment individually and that there is no one-size-fits-all solution for hallux valgus. People with hallux valgus should consult with a qualified healthcare provider to determine the most appropriate treatment options for them and to develop an individualized treatment plan. Expert advice and resources. In the 7th chapter, Expert advice and resources. Readers are provided with additional information, advice, and resources to help them manage hallux valgus. This chapter provides practical tips, further information and contact options for professionals and organizations specializing in foot health. Here are some possible contents for this chapter. Expert tips. A section that provides advice and recommendations from experts in the field of foot health. These may be orthopedists, podiatrists, physiotherapists, or other qualified healthcare providers who specialize in the treatment of hallux valgus. The experts can give practical tips on pain relief, choosing the right shoes, foot exercises, and other therapeutic measures. Additional resources. A list of other resources that can provide readers with additional information and support. These include books, websites, online forums, support groups, and other organizations that address foot health and hallux valgus. These resources can help readers learn more, share experiences, and find support. Glossary. A glossary of technical terms and definitions related to hallux valgus and foot health. This can help readers better understand technical terminology and make the information in the book easier to follow. Checklists and worksheets. Checklists or worksheets that help readers track their progress, create individualized treatment plans, or note important questions for the next doctor's visit. These practical tools can help readers organize their treatment and actively manage their health. Professional contact information. Contact information for professionals and organizations available to readers with questions or concerns. These may include local foot specialists, support groups, or national health organizations that provide support for people with foot problems. Recommendations for further reading. A list of recommended literature that allows readers to deepen their knowledge about foot health and alternative treatment methods. These include books, specialist magazines, or scientific studies on the subject of hallux valgus and foot pathologies. This chapter serves as a practical reference and a point of contact for readers seeking further information or professional support in managing hallux valgus. It provides a comprehensive overview of available resources and expert advice to help readers make informed decisions about their foot health. What other information and resources are available to those affected? For those affected by hallux valgus has a variety of information and resources available to help them manage their symptoms and improve their foot health. Here are some examples. Books and literature. There are a variety of books and specialist literature about hallux valgus and foot health, which can provide additional information and advice to sufferers. These books can address various aspects of hallux valgus, from causes and symptoms to treatment options and prevention strategies. Websites and online resources. There are numerous websites and online resources that provide information and support for people with hallux valgus. These websites may contain articles, videos, forums, support groups, and other useful resources to help those affected learn about their condition, share experiences, and find support. Health organizations and professional associations. There are various health organizations and professional associations that specialize in foot health and orthopedic diseases and provide support for people with hallux valgus. These organizations can provide information materials, organize events, and provide professionals who can help diagnose and treat hallux valgus. Can help podiatrists and orthopedic shoe technicians. Podiatrists and orthopedic shoe technicians are professionals who specialize in the treatment of foot problems such as hallux valgus. They can provide a comprehensive diagnosis, create individual treatment plans, and recommend orthopedic measures such as special insoles, shoes, or orthopedic devices. Physiotherapists and foot specialists. Physiotherapists and foot specialists can help people with hallux valgus to improve their foot health and reduce pain. They can offer targeted exercises and therapies to strengthen muscles, improve mobility, and correct the alignment of the big toe joint. Self-help groups and online forums. Self-help groups and online forums offer those affected the opportunity to meet other people with hallux valgus, to network, exchange experiences, ask questions, and receive support. Exchanging ideas with like-minded people can help you feel understood and receive practical tips for dealing with the condition. This information and resources can help people to learn about their condition, better understand their symptoms, and find appropriate treatment options. It is important that people with hallux valgus should actively take care of their foot health and seek professional support if necessary to relieve their symptoms and improve their quality of life. How can they find qualified medical advice? To get qualified medical advice for hallux to find valgus, sufferers can take several steps. Consult your GP. The first step is to consult your GP. They can take a thorough medical history, assess symptoms, and make a preliminary diagnosis. If necessary, they can refer you to a specialist doctor. Orthopedic specialist. An orthopedist is a specialist in orthopedic diseases, including foot problems such as hallux valgus. They can provide a comprehensive diagnosis, explain treatment options, and perform surgical intervention if necessary. If you would like to see an orthopedic specialist, you can ask your GP for a referral or make an appointment yourself if this is possible in your healthcare system. Podiatrist. Podiatrists are professionals who specialize in the care and treatment of foot problems. They can perform a comprehensive foot examination, adjust orthopedic insoles, recommend foot exercises, and offer other non-surgical treatment methods. Podiatrists can be an important addition to a holistic treatment of hallux valgus. Physiotherapist. Physiotherapists can help treat hallux valgus by providing targeted exercises and therapy to strengthen muscles, improve mobility, and correct the alignment of the metatarsophalangeal joint. They can create individualized treatment plans tailored to the patient's needs and goals. Orthopedic shoe technicians. Orthopedic shoe technicians are professionals who specialize in the manufacture and adjustment of orthopedic shoes and insoles. They can make customized shoes and insoles that meet the needs of people with hallux valgus and help relieve pain and improve foot health. Online search and patient reviews. You can also search online for qualified specialists, podiatrists, physiotherapists, or orthopedic shoe technicians. Check the reviews and experiences of other patients to get an impression of the quality of medical care. It is important that those affected by hallux valgus take the time to seek qualified medical advice and explore different treatment options. A careful diagnosis and personalized treatment can help reduce pain and improve foot health. Conclusion. A life without hallux valgus. In the closing words, a life without hallux valgus, I would like to encourage all readers and give them hope that a life without the burdens and limitations caused by hallux valgus is possible. Although this foot deformity is often considered unavoidable or inevitable, many people have found ways to alleviate their symptoms and improve their quality of life. By working with qualified professionals, committing to regular foot care and consistently implementing individually tailored treatment strategies, those affected can make significant progress. It is important to be patient and to observe your own body carefully in order to check the effectiveness of the chosen measures and to adjust them if necessary. A life without hallux valgus not only means relief from pain and discomfort, but also the regaining of mobility, self-confidence and joy of life. It offers the opportunity to participate actively in life again, to enjoy your favorite activities and to move freely and carefree. I encourage all readers to use the information, advice and treatment methods presented in this book to find their own path to pain freedom and foot health. Every step you take brings you closer to a life without the limitations of hallux valgus. Finally, I would like to thank all readers for their interest in this topic and wish them all the best on their way to a life without hallux valgus. May this book be a valuable resource and a helpful companion on your journey to greater health and well-being. Rights and ownership notice. This audiobook is published and distributed by Testbericht-Institut LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Testbericht-Institut LLC. Testbericht-Institut LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Testbericht-Institut LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership: the 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited. Copyright Testbericht-Institut LLC. All rights reserved.